All right, guys, the first mobilization we're going to talk about is a banded ankle mobilization. For this one, we're going to want to use a relatively thinner band, and we're going to hook that band around the talus. So that means it sits just below the malleoli. If you remember your palpations from last semester, we're going to find the medial and lateral malleolus. We're going to slide that band to where it's off of those bones, so it's not restricting the tibia or the fibula, but it is capturing the talus, giving a gentle downward and posterior pull to the talus. Now from here, we're going to maintain a solid arch position. I have a relatively low arch, but I don't want to see that collapse anymore as we do the movement. From here, we're moving into ankle dorsiflexion with the knee following the line of the second toe. We don't want it coming in. We don't want it coming excessively out, although in is much more common, so that's what we're usually watching out for. We'll go up to the limits of our mobility and oscillate there, so I can do 10 to 20 repetitions just oscillating near end range. Back off. Should be a comfortable technique. The band will put a little bit of pressure at the anterior ankle, but it should not be painful. And in terms of stretch, it'll probably feel actually less intense than if you were doing something like a classic calf stretch. The movement that we're trying to get is a more subtle gliding motion at the joint. The analogy to this is the roly-poly on the hill that we talked about earlier. So as the roly-poly moves over the hill, he rolls and glides in the same direction. That's what we're trying to facilitate with the tibia rolling and gliding over top of the talus, so that the tibia would move forward. As it rolls forward, it glides forward, and the talus would move posteriorly, backwards. We're trying to facilitate, that is the normal arthrokinematics, the normal joint sliding motion that occurs. We're using the band to facilitate, to make sure that that is happening. Our test-retest for this one, it's a good idea if you're going to use this mobilization to kind of test out your range of motion, whether that's actually measuring or whether that's getting a feel. We can perform a movement like a squat or a pistol that requires a lot of ankle range of motion. Perform that before and after the mobilization, see if it makes a difference.